Hello, I'm Gareth Jones. I'm a Senior Market Analyst with Signify Research. I'm part of the clinical care team and I cover the areas of diagnostic cardiology and patient monitors. So I'm here today to talk about our newly released Diagnostic Cardiology Global Market Report. So in terms of some of the key technological policy trends we're seeing in the diagnostic cardiology market, first of all, artificial intelligence. It's been across the news everywhere of late, across all industries. In diagnostic cardiology, the last 12 to 18 months, it's really starting to make an impact. So we're seeing a lot of artificial intelligence algorithms now being released onto the market that enable the quicker and more accurate diagnosis of arrhythmias, which is traditionally what an ECG device is used to detect. This is particularly important in light of the ongoing challenges around cardiology shortages, shortages of specialists. So for example, in a primary care surgery, a GP surgery, very often it's a non-specialist, a non-cardiologist who is trying to interpret an ECG readout. So while there is a certain level of accuracy, by being assisted by an algorithm that can both speed up the diagnosis to enable a more efficient sort of workflow and a more efficient use of the GP's time, primary care physician's time. It also can improve accuracy, especially in the case of non-specialists. We're also seeing lots of the ambulatory devices now being integrated with AI, again for helping with some automated detection. I must stress that most of these algorithms stress that they still need to be signed off by a clinician, but it can speed up decision making, which is particularly important in light of increased sort of demand for healthcare services, especially in cardiology, balanced against the dwindling numbers of cardiology specialists that are operating. So another very interesting development we're noticing is the use of AI algorithms to diagnose structural heart conditions, whereas previously an ECG readout would only have been able to detect an arrhythmia. Thanks to advances in AI, these algorithms can now detect structural issues which previously would have required a much more expensive imaging procedure. So again, this can help to reduce costs for healthcare providers. It can help speed up diagnosis. For example, 12-lead ECGs are fairly ubiquitous throughout many health systems, whereas imaging equipment, as I said, far more expensive. So access to that is somewhat restricted. So again, by enabling this sort of very much lower cost device to be able to diagnose structural heart issues, again, it can help with patient workflows, with reducing costs. And we're starting to see these algorithms gain regulatory approval in the US, but also in Europe. So that's another very interesting AI-related theme in the diagnostic cardiology market. So as I said before, our latest Diagnostic Cardiology Global Market Report has just been published. So if you'd like more information, please feel free to reach out to me on LinkedIn. Alternatively, there is a link with this video which will direct you to a brochure which will give you more information on the report. So thank you very much.